The District Medical Officer of Health is encouraging people to get the COVID booster shot once they're eligible. Dr. Janet DeMille says the health unit already has booster appointments starting as early as next week. And as the case count rises, DeMille is also reminding residents that we're not out of the woods just yet. Catalina Gillies has more.
After seeing the highest active COVID-19 case count in Thunder Bay since mid-June on Thursday, the district's medical officer of health says it's concerning, but in some ways not surprising.
We've seen a lot of relaxing of some restrictions and maybe people having more interaction with one another, and it is allowing sort of COVID to spread.
The district has seen low case numbers throughout the late summer and early fall, but Dr. Janet DeMille says we are now on the brink of seeing a rise in cases.
What I've always said in the past is COVID is tricky. It's going to appear to, come out of the blue sometimes, and it's going to spread quickly, especially when people are together.
However, there is some positive news on the horizon. The province announced it will be expanding eligibility for booster shots to more Ontarians. DeMille says she will be encouraging Thunder Bay residents to get the extra jab and that they've been actively planning for the ramping up at vaccination clinics.
Booster shots, are going to be given to people 6 months after their second dose, and it's actually just going to give them an added layer of protection against COVID-19, both getting an infection and also, again, preserving that protection against serious outcomes requiring hospitalization.
The Ford government also recently announced its long-term plan for lifting all COVID-19 public health measures. If there aren't any concerning trends, the vaccine passport could be gone by January, and all mask-wearing requirements could be gone by March.
That was one aspect that I was uncomfortable with, and the proof of the proof of vaccination, I think, is still very important. I wasn't too thrilled by that particular removal, at least in January. I would like to have seen that a little bit later, but I recognize that it's really going to depend on what happens over the next couple of months.
Catalina Gillies, TBT News.